Hello, YouTube. Just a quick update. I know I'm a day late because yesterday was my 3-week anniversary from having gastric bypass in Mexico, Dr. Lopez, through Specialized Bariatrics and in Tijuana, Mexico. So, anywho, I would have done this yesterday, but had a little bit of an exciting event. I'll get to the numbers first, and then I'll kind of fill you in what's been going on. I'm doing this with my phone, so I try to look right at the screen, but then I might be supposed to be looking there. I don't know. I'm just going to look at the dot, I guess. Anyway, my highest recorded weight was 265. Day of surgery, we're going to round now because I don't like the points, was 252. And my current weight is 234, so that's 18 pounds lost since the day of surgery and a total of 31 pounds. So doing good, feeling good, was feeling so good last week. Anyway, what's been going on that delayed my video and what have you is went and saw my doctor last Thursday, got released to go back to work yesterday. Decided last week after, just kind of, checking the scale every day and it not moving much and not a lot of anything moving much, that maybe I was taking stool softeners and fiber in my tea every day and trying to get things kind of normalized. I didn't feel they were normal enough apparently, so Friday night I decided I was going to take half a dose, not the whole cup dose, but half a dose of milk and magnesia. Well, that's all it took, and pretty much things got moving, and they moved all weekend long, and not in the most pleasant way. I think that my surgery must have crossed the wires, because when one end decides it wants to contract and do naughty things, it tells the other end to do the same. So when you're trying to do one and it doesn't feel so good, and you're trying to throw up on the other side, but nothing's going to come out because there's nothing in there but spit, and it's nightmare. Nightmare is all I can say. Not a fun weekend. So thought, okay, didn't do much this weekend at all. Laid around, drank a lot of fluids, tried to recover, even though it just kept going and going and going and going. And I'm like, what is going on? Anything that went in came right out. So fought through it through the weekend. Got up yesterday to go back to work. Was very excited. Missed my friends. Bored out of my mind here at home. Still having the issues yesterday morning. After going about 2 or 3 times to the restroom, I looked at my husband. I says, I don't know if I should leave and go to work or go to the bathroom again, but I just left and I went to work and got to work and had a few episodes at work, but tried to tough it out, and was having some really bad pain on the upper right part of my stomach, right from the rib cage to the right around my rib. So of course I self-diagnosed myself on the internet because I'm an internet doctor, and I figured, gallbladder, because that's where it was, and it can cause all the diarrhea and the nausea and all the good wonderful systems. That's I look really wonderful today. So I after doing my deal yesterday and pushing through work, I decided maybe I should go to the doctor and make sure everything was okay. Having surgery in Mexico, even though it was a great experience, I'm still a little paranoid about what if something goes wrong. So I left work at 2:30, and my husband said, don't go to your doctor, go to the emergency room, because they've got the ability to take more tests and do all that than that old doctor's office. So instead of making 2 trips, I just went straight there. And after waiting for 3.5 hours to be seen, because Monday is apparently a busy day at the emergency room, I got in. They did, gave me IV fluids, which was great, and wound up doing a CT scan. So I had to drink all the contrast and then do all that, and that was cool. Then the good thing that came out of it is that the contrast showed that my surgery was perfect, that my stomach, my little baby pouch, mini me, she's great, no leaks, no blockage. They did say that they had seen some looping in my intestines, but nothing blocked in there, just a little inflammation and stuff like that. So I was like, well, okay, let's try to figure out what's causing the diarrhea because that should have been gone. I mean, I took the milk and magnesium, only half a shot Friday, and now it's Monday, and it's still there, and I was just miserable. I mean, just, oh, miserable. Never, ever, ever, ever had it this bad in my life. So then we started talking about, and I don't know if you all recall, if you saw my 1 week video, how I kind of held up my hands and showed you how they were tingly and they were really red. Well, then after I stopped taking the antibiotics that I'd gotten in Mexico, like a couple days after they were tingly, the tingly started going away. And I went, maybe I had a little reaction to the antibiotics. Because I'm allergic to penicillin and, so I've had things before. Okay, so then as soon as the tingling went away, I have really soft hands now because all the skin peeled off the palms of my hands, on both hands. So I was molting. And that's pretty much almost all the loose skin's gone now. So the doctor said that a very common reaction when you have a reaction to antibiotics that can happen is a form of colitis that is caused by the antibiotics. Oh, you don't ever want colitis because if that's what this is, it's not good. So apparently that's what they're thinking it is, that I have colitis from that, which is an irritation of the bowel and terrible diarrhea and pain and blah, blah, blah. So, so today I stayed home from work again, so most of yesterday, home today, because I had to go get a prescription for pain medicine, because there's not much they can do for it, and an anti-nausea pill, which I haven't taken, because the pain pill's working just fine. And then an antibiotic, which was obviously called in somewhere last night, and we don't know where, so we got to track that down. And hopefully this should make it feel better. I feel much better now as long as I stay on the pain medicine. I don't have that. I'm not having the issues. So hopefully that'll relax it, plus constipate you a little bit, which I could use. And not to the extreme, but definitely could use. So all is well. Surgery stuff's perfect. Tummy hurts, but I should be fine. Go back to work tomorrow morning and then go see the surgeon for a follow-up. And he'll determine, hopefully I won't wake up in the middle of the night like I've been. Things will be getting better. So, other than that, I was doing really good. And I know I'm going to do really good. So, I don't want to make this too long because that's just kind of a boring topic. But you never know. Somebody might experience the same thing. And when your stomach is hurting like that and you're trying to throw up, nothing's coming up. And you just had bariatric surgery, kind of scary. You think something's really, 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 really wrong. So all is well there, and just an allergic reaction probably to the antibiotics, most likely. But other than that, I'm doing good. Hopefully by my next Monday video, which I should make on Monday, I will look better. I will feel a bunch better and be several pounds lighter, hopefully. Who knows? So, but I'm sure a few, and I'm happy with that. So I just wanted to thank everybody that sent me well wishes yesterday on Facebook and who've commented on my journey so far and my subscribers, and I hi to all those I subscribe to. Everybody seems to be doing great, and other than that, 18 pounds down from surgery, and a little ugly today, but I will get back to y'all at week 4, which will be next Monday. So have a great day and drink lots of water. Okay, bye.